Hello everyone, welcome to mindbraintalks, the place where you find diverse and scientifically accurate information regarding psychology, neuropsychology, neurosciences and research methods every single week. My name is Bruno Faustino. I am a licensed clinical psychologist and neuropsychologist who's been working as a therapist, researcher and educator for the past few years. Here in mindbraintalks, I discuss and describe different topics from psychology to neurosciences, and I try to explain them the best as I can for you to learn something more about it. All contents here are just for educational purposes and it's not intended to diagnose any psychiatric condition or neurological disorder. So, without further delay, let's jump for today's content. Today's topic is related to clinical psychology. What is clinical psychology? What clinical psychologists do? I will try to answer these questions with this video. So, this video is very important to me because, as you know, I am a clinical psychologist and I am a researcher. In this sense, I will describe to you the essentials and the fundamentals of clinical psychology. I will describe here the major theoretical approaches that clinical psychologists use to identify and describe normal and abnormal behavior, and I try also to explain the differences between clinical psychology, psychotherapy and psychiatry. So please stay to the end of the video. So now let's look to the manuals that I recommend to you. The first is Introduction to Clinical Psychology. The second is the Oxford Handbook of Clinical Psychology. The third is the Clinical Handbook of Psychological Disorders, edited by David Barlow. The fourth is What Works for Whom, second edition from Peter Fonagy. The fifth is the Oxford Handbook of Research Strategies for Clinical Psychology. And the sixth is the Clinical Psychology, Science, Practice and Culture. And now let's see what is clinical psychology. Clinical psychology may be viewed as a branch of psychology, typically focused on applied psychology. It's focused on the assessment and intervention in mental health conditions and psychological disorders. Typically, clinical psychologists fundamental their basis on a research-informed practice, and clinical psychologists need a master or a doctoral degree to exerce this profession. So, in a more in-depth definition of clinical psychology, we pass by this. The field of clinical psychology integrates science, theory and practice to understand, predict and alleviate maladjustment, disability and discomfort, as well to promote human adaptation and adjustment and personal development. Clinical psychology focuses on the intellectual, emotional, biological, psychological, social and behavioral aspects of human functioning across the lifespan, in varying cultures and at all socioeconomic levels. Clinical psychology is focused on psychological assessment, which is a core skill of clinical psychologists. Typically they use clinical interviews and observations, neuropsychological tests, personality tests, intelligence and achievement tests, and clinical scales to understand behavior and to understand and differentiate abnormal and normal behavior. Clinical psychologists use this information to identify psychological functioning and the relationship of this psychological functioning to symptomatology. This information from psychological assessment tend to inform diagnosis, treatment selection and prognosis. There are different theoretical orientations that clinical psychologists tend to perform in the university settings. So let's see the main theoretical orientations. So the first is psychodynamic psychotherapy or psychoanalysis. The second is cognitive or cognitive behavior oriented therapies. The third is humanistic or experiential approaches. The fourth is systemic or family system therapy. And the fifth, which is integrative psychotherapy, which is a form of psychotherapy that tends to have different views from every specific theoretical approaches and try to use the best of them to incorporate in a different view of case conceptualization and clinical decision making. As a clinical psychologist, my main theoretical roots are in cognitive behavior therapy and in integrative psychotherapy. In this sense, I have these two main theoretical approaches that can help me to understand normal behavior and abnormal behavior. In this sense, I am able to understand things from a theoretical standpoint from cognitive behavior therapy, from the first to the third generation, and I may also include some theoretical approaches from integrative psychotherapy, which is able to understand the main points and the main fundamentals of normal and abnormal behavior from different integrative theoretical points. In this sense, I can use two different views from clinical psychology, one focus in cognitive behavior therapy vision and one focus on integrative psychotherapy vision, to understand and to identify normal behavior and abnormal behavior. And then I can use these visions to better conceptualize patients and to better select different treatment options. So, this is why I've used an integrative perspective on case conceptualization and clinical decision making. So, but don't worry, in the future I will make different videos and explain to you what is cognitive behavior therapy and what is integrative psychotherapy. So, stay tuned! Clinical psychologists tend to work in different psychological disorders, such as anxiety and depression spectrum disorders, such as social anxiety, generalized anxiety disorder, depressive disorder, and so forth. Bipolar spectrum disorders, such as bipolar type 1 or type 2. Obsessive compulsive disorders, OCD, hypochondria, trichotillomania. And somatoform and physiological disorders, such as somatization, conversion disorder, and others. Another psychological disorders that clinical psychologists tend to work on is trauma, dissociation, and post-traumatic stress disorder. Eating disorders, addictive and impulse control disorders, psychotic disorders, sleep disorders, sex and gender dysphoria, and personality disorders. So, clinical psychologists may work in different settings, such as private practice, healthcare services, public and private hospitals and health clinics, schools, universities, and health departments in diverse companies. Clinical psychology is very similar to psychotherapy, however, there are small differences between them. Psychotherapy is also rooted in psychological approaches, such as CBT, psychodynamic, integrative. Psychotherapy may be viewed as an specialization of clinical psychology. So, clinical psychologists, to be psychotherapists, they must do an specialization on specific specific psychological approach to develop more core skills on psychotherapy. It requires more 3 to 5 years of specialized training to develop new core skills or to enhance relational skills to be a psychotherapist. Psychotherapists tend to be a more specialized approach to psychological disorders. So, psychiatrists may also specialize themselves in psychotherapy. It's the same to clinical psychologists, they must do the specialization to become a psychotherapist. And now let's look to the difference between clinical psychology and psychiatry. Clinical psychologists are trained in psychological methods and intervention tasks to deal with psychological disorders. They tend to have a more psychological and developmental view of mental illness. So, clinical psychologists tend to have a more contextual view of psychological disorders. Now let's look to psychiatrists. Psychiatrists are medical doctors who normally use medication to treat psychiatric disorders, and they tend to have a more biological view of mental illness. So, if you have a more biological view of mental illness, they try to treat this mental illness with medication. On the other hand, psychologists try to treat psychological disorders through psychological methods, behavioral methods, cognitive methods, and relational methods, which is very different from the approach of psychiatry that normally use medication to treat psychiatric disorders. Normally, a combination of these two aspects may benefit the patient. So sometimes it's better to combine these two approaches. So a patient may have a psychiatrist and a clinical psychologist and a psychotherapist to work from relational methods to treat his illness. So both may have an integrated perspective of biological and psychological view of psychological disorders, which is the normal way of today. Today, psychologists and psychiatrists, they both have a view where psychological disorders are the result of biological factors combined with environmental factors. That's why that an integrated and a combined approach from medication to psychotherapy or clinical psychology approaches may be a better option to treat, and they tend to have better results in clinical outcomes. So, as you are seeing here, psychotherapy may be viewed as an specialization of clinical psychology. Typically, mental health professionals who study to become psychotherapists are clinical psychologists and psychiatrists, because these are the ones who have a major theoretical background in psychological processes, and then they are able to understand how to apply psychotherapeutic principles within a therapeutic relationship and to apply these principles to enhance cognitive, emotional and behavior change. That's why these professionals are more qualified to become psychotherapists. However, they all must study more 3 to 5 years. It depends from country to country. It is important to know this is a brief video about clinical psychology and psychotherapy. There are many important topics that were left out from this video. So don't worry, in the future I will produce some different videos focused on these specific subjects, so stay tuned. So now let's just summarize the contents of today. We saw that clinical psychology is focused on mental health conditions and it's a branch of psychology. We saw also that clinical psychology is focused on the assessment and intervention in diverse psychological disorders. Psychological disorders have different spectrums and are diverse from anxiety to personality disorders. And clinical psychology is somewhat different from psychotherapy, and psychotherapy is somewhat different from psychiatry. Well, it's all for today. Don't forget to see the video description regarding today's theme to look to the manuals and the books that I recommend to you. Also, if you like what I'm doing here, please consider to subscribe and hit the bell for notification. You may use the comment section below to express your thoughts and to express your mind. Welcome to Mind Brain Talks, and I hope to see you in the next video. Bye!